Hey guys, this is Dr. Hub. Today we look at identifying. So we'll identify what is known as the Mapleson circuits. So to begin with, we look at the Mapleson A. And before we move ahead, there are some components we need to focus on. So we'll be asked on the where is the FGF. So they are the short forms. So FGF is nothing but the fresh gas flow. And next what we need to know is the APL. APL stands for the adjustable pressure relief valve. So let's write it down. This is the fresh gas flow. These are some things which will be helpful throughout this end of the video. So APL stands for the adjustable pressure relief. So adjustable pressure relief valve. Next, there are another component which we need to know, that is the corrugated tubes. Corrugated tubes are the tubes with the striations. Corrugated tubes. And next, this we know it is a reservoir bag. So these components should be very familiar as we move ahead. So now let's look at the Mapleson A. So how does the MA, that is the Mapleson A, look? So let's draw the diagram. So we have the reservoir bag. So just beyond this we have this is the FGF. This is the reservoir bag. Okay, and then we have the tubing, and this is the corrugated tubes are present. Then comes the way to the patient. So this is the patient. And between the corrugated tubes and the patient there is APL. This is APL. So this forms the Mapleson circuit A. So the FGF is near the bag, whereas the APL valve is near the patient. Okay, hope it is very clear. Then we move on to the Mapleson B. So this is MB, Mapleson B. So in terms of Mapleson B, we have the reservoir bag here, and then comes the corrugated tubes, and just after the corrugated tubes B, right? So B means there are two. So two are present here. So in sequence A is 1 and B is 2. So both of them are present on the towards the patient side, that is the FGF. FGF we saw it is nothing but the flow. So the fresh gas flow is also present. Then there is also the presence of the APL. APL was the adjustable pressure relief valve. So here it comes and there is a patient. Patient is present. So there the corrugated tube is present, there is a reservoir bag, and the FGF and APL are present towards the patient side. This is all about the Mapleson B. Next, we move on to the Mapleson C. So Mapleson C, there is just Mapleson C is very small, so we need to know it. So C is small, so there is a reservoir bag. There is no corrugated tubes here, so there is just the patient. So this is the patient mask, and there is a FGV. It's similar to that of the B, so you just remove the corrugated tubes. So this is the FGF. Next is there is a APL. So this was about type C. Next we'll look at the type D. So this is type D. So in terms of type D, there is presence of the reservoir bag. So there is a reservoir bag, and there is presence of the corrugated tubes as well. Then there is a patient. So here it is similar to that of the type A, but they are in opposite places. That is, towards the reservoir bag there is APL. There is APL. And when we see towards the patient, it is the FGF. FGF is nothing but the fresh gas flow. So it is just the reverse of that of the type A. Next we move on to the type E. So we are looking at the Mapleson E. So in terms of the Mapleson E, there is presence of corrugated tubes. So there are presence of corrugated tubes, and then there is a patient. So this is the patient. So E is looking very incomplete. So E is what? Incomplete. So there is a FGF here. So there is FGF here. So there is just FGF, patient, and the corrugated tubes. So which looks very incomplete, it is the Mapleson E, which is looking very incomplete. Then we look at F. F is the last one. So in terms of F, what do we have? In terms of F, it is very similar to that of E. So in terms of E, what we saw is there is presence of corrugated tubes. Then there was FGF. FGF stands for the fresh gas flow. And then there is a patient. Then it goes to patient. Whereas in case of F, there is an addition of the reservoir bag. There is an addition of the reservoir bag. There is no presence of APL in case of E as well as F. So this was about the representation and identification of the Mapleson circuits. Now let's look at some examples of each. So in terms of A, Mapleson A, it includes the McGill as well as the LAC. This is the coaxial. Next we look at B. So B is obsolete, and C is also obsolete, and it's still used in case of emergency resuscitation. So it is used in emergency resuscitation. So this is very commonly used in workshops as well. That is the ambu bag, known as the ambu bag. The ambu bag is very important. Even the labeled components of the ambu bag is very important. Next comes D. D includes the bane. It is the bane, that is, it is coaxial. Then we look at E. So E includes the Aries D piece. Then we move on to the F. What happens in case of F? So in terms of F, it includes the Jackson-Rees. So it includes a Jackson-Rees. So we saw E was for Aries. So it rhymes, right? Aries. And then comes Jackson-Rees. This is for F. Jackson-Rees. As well as modification for the pediatric patient. This is nothing but modification of the pediatric patients. So this was all about the modifications, that is the identification of the Mapleson circuits. To learn and grow daily like this, please do subscribe.